Welcome everyone to today's Lunch and Learn, which is organised by the North Cumbria Integrated Care Trust and CLIC, the Cumbria Learning and Improvement Collaborative. It's good to see you all here today. My name is Richard Laurie and I work for the Knowledge and Library Service at the North Cumbria Integrated Care Trust. And it's my pleasure today to welcome Tracy Garbarino, who also works for the Knowledge and Library Service here at the Trust as a knowledge support officer, and Tracy's work mainly focuses on connecting healthcare professionals to the best health information, and she'll be giving our session today on health literacy for health equity. The idea of these lunch and learns is that they are a relaxed, informal space for health and care staff to come together to share experiences, learn something new relating to health and care, focus on quality improvement, and be signposted to further resources.
So, hello everyone. As Richard said, my name's Tracy and I am a librarian and based in Carlisle here, but working across Whitehaven as well. But I also work part-time for the primary care training hubs. I have been a librarian for many years, including in schools, and in Carlisle, when I was the school librarian, I was also the literacy coordinator. So taught students their basic literacy skills, reading and writing. I worked in Vietnam where I taught information literacy and came to work in health libraries last year where health literacy became a big part of my role. So today we're talking about health literacy. So what do we actually mean by health literacy? This is the World Health Organization definition. I'll give you just a few seconds to read that. And I think you may agree that it's quite ironic that this is quite a tricky sentence to process. But there's many different definitions of health literacy out there. But in a nutshell, it's about people's ability to engage in their healthcare decisions. The statistics around health literacy, let's have a look at those. So firstly, 43% of the population don't have the literacy skills to understand health information. If you put numbers alongside the text, it jumps to 61%. And this study is by Jill Rowlands, who is a practicing GP in the North East, and she also works for the North East and North Cumbria Applied Research Collaborative. And I think you'll probably agree that those statistics, that data is quite startling. In fact, the National Literacy Trust have called it a crisis in adult literacy that directly impacts on people's health. So who are these people who are affected by their health literacy levels? Well, it's people living with social and economic disadvantage. It's people with low educational attainment. It's older people, and it's people who have long-term health conditions. It's people with disabilities, and it's people with low information and technology skills. However, our health literacy levels, they can affect us all. Particularly in a stressful situation. Think of how you feel when you receive some shocking news. Or think of how tired you are as a new parent and all of the new health-related information that you need to digest. I'm going to introduce you to Dr. Graham Kramer. So I think perhaps we can all agree that we've been in a similar situation to Dr. Kramer, nodding, agreeing alongside any instructions that we've been given about our IT or about our computer and not really genuinely understanding what's happening. So what does it mean on a day-to-day basis? Adults who have low language literacy and numeracy skills and their children and their families do suffer the worst health outcomes in society. And thinking back to the statistics, if roughly half of the adults are struggling to routinely understand the information that they're being given, what are the implications for the clients and the service users themselves, and indeed your own service? So think about the language and the terminology that we're all familiar with, that we know the NHS loves a bit of jargon and some acronyms thrown in. So think about that language and terminology that you use without probably even thinking about it on a day-to-day basis. What words or phrases do you use regularly, and how much do we take those for granted? Adults who have low language literacy and numeracy skills, remember, and their children and their families do indeed suffer the worst health outcomes in society. There's a guy called Jonathan Barry who works for NHS England, and he has a blog online called Does Health Literacy Matter? On his blog, you can find real life stories from patients and staff experiences of why health literacy or why literacy levels are really important in healthcare. One example is a gentleman was referred by his GP to get an X-ray at his local hospital after experiencing breathing difficulties. He went along to the hospital with his referral letter, and after wandering around and looking at the signage and reading pathology and podiatry and radiology and urology, he actually gave up looking for X-ray and was too embarrassed to ask. So think about the consequences of that scenario, never mind the actual effect on Peter's health. So poor literacy levels are, of course, limiting to everyday life, but especially limiting for our health. And there is an absolute direct link between people's basic skills and the health outcomes. We know that people who have the lowest basic skills are those who suffer the worst health outcomes. And by that, we mean people with lower education levels and low health literacy levels are more likely to die of preventable diseases. They're more likely to have difficulty managing medication. It's more common that they have long-term conditions, and those long-term conditions are more likely to be limiting. They're less likely to engage with disease prevention like cancer screening and immunization, and they're more likely to adopt unhealthy behaviors like consuming too much alcohol, poor diet, or smoking. And lower literacy levels also means that people are less responsive to public healthy living campaigns. However, do remember, as I said earlier, that our health literacy skills can affect us all at some point in our lives. So what does it actually mean for the NHS or indeed your own service or department? It means quite often there's an escalation to acute services, inappropriate use of services, missed appointments, poor patient experience, and of course, wasted medication. And there was a study out in 2015 in 2020 that estimated low health literacy levels costs between 3 and 5% of the national health budget. So what we've been talking about is functional health literacy, so skills to actually read, process, and use information. And poor health literacy is not just about having low skills, although that's one of the most basic barriers to good health literacy and health outcomes. It's also influenced by personal characteristics. So if you're unemployed or not a homeowner, if English is your second language, or if you're older than 45, have a low income or live in a deprived area, and it's even influenced by sex. Men are at a higher risk of low health literacy, whilst women are at a higher risk of low health numeracy. And social resources also come into play. Do people have enough money to buy a smartphone or a laptop? Therefore, can they access all of the online information and increasingly online services available? So how do we measure health literacy skills, and what's it like locally? There is a tool called the Health Literacy Geodata tool, which is from Southampton University in conjunction with Health Education England, and it indicates the percentage of the population aged between 16 and 64 who are likely to have difficulties in understanding or interpreting health information. And it looks at the levels in England and reports that 43% of adults aged between 16 and 64 will have this difficulty. So 43% is the national average. In Cumbria, the Carlisle area is about on line with the national average, as is Allerdale. Copeland is slightly higher, with Barrow-in-Furness slightly higher still. Eden lower, and South Lakeland lower. So you can see that variation just in our county. And of course, it doesn't dip much, it doesn't go below 34, so it's still a substantial amount of the population. So what can you do to improve your own skills? Well, I think you'll agree that by improving health information and communications, we can contribute to reducing some of the problems around health inequalities. And the first thing you can do is log on to the eLearning for Health and complete the health literacy module. You'll need an Open Athens account to register, and then it's free and it takes about 35 minutes. If you don't have an Open Athens account and don't know where to get one, you can simply get in touch with your local library service. Now, the module talks about some different techniques that you can use in the workplace. Teachback is one of those techniques, which is simply asking the patients or service users a bit more than just, do you understand? Asking them to teach back or show you what you've been talking about. So it might be actually show me how you're going to use your inhaler. And chunk and check is breaking things down into manageable chunks and using a bit of teach back in between. You can learn all about this on the e-learning for health module with some practical examples. And it might be simply using pictures, putting things into large print, using simple language. And the main thing to remember is not to worry about feeling as if you're patronizing your service users. It's not dumbing down information. Think of it more as leveling up. So health literacy is not just about literacy and numeracy skills. It's actually underpinned with information literacy and digital navigation skills. And these are essential for interaction with increasingly digital health and care services. As more healthcare services and information is provided digitally, we need to focus on vulnerable and marginalised groups to ensure equitable access to health service. So what do we actually mean by digital literacy? It's the ability to use information and communication technologies and how we find, evaluate, create and communicate information that requires not just cognitive skills but also technical skills. Now, Health Education England have a digital literacy assessment tool that you can use by yourself or indeed with a team or a department. And you go through the tool, all the instructions are really self-explanatory, and then it'll give you a review at the end and point you in the direction of some further training according to your specific needs. What do we mean by information literacy? It's about appraising information or indeed spotting misinformation. And we've all heard of fake news, and the pandemic really put a spotlight on this. Fake news spreads faster than any virus and can indeed be just as dangerous. Think about where you get all your information from, and think about all those different sources of information and how do you know that they're reliable? And of course, think twice, if not 3 times, before sharing anything. I think we can probably all remember the 5G conspiracy theories that were shared on social media, and the coincidental rollout of the 5G technology gave rise to rumours linking the new technology to the new coronavirus. Whilst the majority of the population were locked down in their houses, social media was rife with rumours and speculation, and this piece of misinformation, it was estimated, went global much in less than 24 hours, which means it took quite a while for the myth to be debunked by trusted sources. So how can we make informed decisions about what we read? There's lots of different models out there that you can use to appraise the information that you read online, but I really like the CRAP test, simply because it's easy to remember. So the C stands for currency. When was the piece of information produced? If you think about the news back in early 2020, it was all changing daily, if not more frequently. So look for a date on whatever it is you're reading. The R is relevant. So we all know that it's very easy to get sucked down a Google rabbit hole when you're looking for information. So check the relevance of what it is you're reading. And also the authority. Who's the author? Who wrote that piece of information? And do they indeed have the expertise to be writing about it or commenting on it? So don't be frightened to just Google the author and find out. And what about the facts? Is it accurate? There's lots of fact check websites out there, like fullfactcheck.org and factcheck.org. And think about the purpose of the piece of information that you're reading. Is it clickbait? Is it just a sensational headline that makes you click onto that article, and when you read it, it's not actually relevant or it's not what you were looking for? Or is it just an advert for something to get you to buy something? And of course, double check, is it a scam? So where can you find trustworthy patient information? The first place, or one really good place, is the Patient Information Forum. It's UK membership organisation and network for people that work in healthcare. And it also runs the only UK-wide quality mark for health information called the PIFTIC. It's got some good resources, guidance and advice on their website. But if you're looking for something or reading something that has that tick, you know that it's trusted information and you can use it and share it. There's patient.info, which looks at major headlines and conducts research and provides a summary about the credibility of news. There's, of course, nhs.uk, which used to be called NHS Choices. There's healthtalk.org, which has got lots of resources developed by clinicians and service users in a variety of formats. So it might be in large print, there might be audio versions. And there's also BMJ Best Practice, which is a clinical decision support tool for health professionals, but it has a large area with patient leaflets. So you can have a look on there and see what's available too. And you can also, of course, contact your local library service and ask for advice about producing or sharing patient information. There's also lots of tools that you can use and share in the workplace. One of them is Health Education England have produced a health literacy how-to guide. It's quite a big document, but you can dip in and out of it, and it's got lots of practical advice and information and resources to not only use yourselves, but share with your teams and departments. Great Ormond Street Hospital have a really good comprehensive health dictionary that you can access online. And the Centre for Disease Control and Prevention have a plain language thesaurus. So in either of those two, you can look up a term or a word. It'll give you an alternative words or words to use instead, and it gives you a really comprehensive definition. The Library and Knowledge Service for London South have produced a really good schools toolkit with lots of guidance and resources to use in schools or with children. And at the opposite end of the scale, there is the Deaf Literacy Institute, who work across different systems, people and places to embed skills, experience, actions and knowledge. And you can find lots of advice on their website about communicating and talking about death and grief. Now, I realise that there's a lot of resources and a lot of information that I've just shared with you all today, but I put them all into one Padlet, which I will share in the chat, so you can access all of the information there. But of course, please do get in touch if you want some further information or advice. And of course, I'm more than happy to come to departments or chat to teams or indeed to speak to people one-to-one. And thank you very much for listening.
Oh, fantastic. Thank you for that, Tracy. That was excellent. So we've now just got a short period for any questions if anybody would like to ask anything of Tracy. But as I say, she's advertised her email address there if you want to get in touch with her as well. If you do have any questions, just pop them in the chat. One thing I did notice, Tracy, was you mentioned that sort of the difference between men and women. Men are more numerate and women, the literacy tends to be better. Do you think that's just a sort of traditional stereotyped coming through, or?
I think it might be a traditional stereotype coming through, but in the resources, you'll find the full paper and research from Jill Rowlands, and some of it does ring true. And the National Literacy Trust website is also a great port of call for statistics and data. And so whilst it is a bit of a general stereotype, it still today rings true. The research and statistics and data, well, the proof is in the pudding, really.
Yes, no, definitely. Oh, and yeah, so Julie Bailey just says no questions, but very informative and thought-provoking. So thank you for that one, Tracy.
Richard, can I kind of in Pippa Tallis has put something in the chat. Might be worth you just saying a few words about how our library service supports staff in the trust with patient information, and maybe we could go along and talk to Pippa's team. But there's a message in there about supporting what support we give to teams around patient information that trust teams are producing.
Yeah, if you just get in touch with us, Pippa, and I'll try and get your email address off this. We can go through that, because we can come and talk to you about producing patient information or where you can find it. But I say we've got various people from other trusts on here as well, so I won't go through that in detail here. But I'll drop you an email, Pippa, about that one. Absolutely happy to do that. And yes, we've got a few more people offering thanks as well. So I think that's probably a good point to sign off now, Tracy. And thank you for today. It's been very useful and very informative, and hopefully we'll see you all at the future session. So thank you very much.
Thank you. Bye-bye.